Hi, I'm Isha Jain. I'm a core investigator at the ARC Institute and a professor at the Gladstone Institutes at UCSF. I'm thrilled to be here virtually. I'm telling you about my lab's work on developing this unusual concept of low oxygen as a therapeutic strategy for mitochondrial disorders. This is still in the early phases of research, and so still much work to be done to reach the patient population, but I'm eager to tell you about our progress so far. This journey started when I began thinking about the reason that things go wrong in the setting of mitochondrial disease. As we all know, mitochondria are the powerhouse of the cell. They make energy in the form of this currency known as ATP. And to make energy or ATP, it requires what's called the electron transport chain, shown here in blue. And in the process, oxygen is converted to water, and ADP is converted to ATP, and ATP is what's used to make energy. And so, for a long time, it's been assumed that the major problem when you have a broken electron transport chain, as occurs during many mitochondrial diseases, that the problem is likely that you just don't make enough energy. And while that's definitely true to some extent, that approach or that thought approach has not yielded promising therapeutic strategies. And so we took a step back and asked more fundamentally, what else is going wrong when there is a broken electron transport chain? And we realized that another problem might be that you might accumulate excess unused oxygen because it's not being converted to water by the electron transport chain. And actually, every time that you or I take a breath, 90% of that oxygen is converted to water. And so, if that's not happening because of these genetic mitochondrial diseases, perhaps we're accumulating excess oxygen in tissues, and maybe the body is not prepared to handle this accumulation of too much oxygen. And so, to test this concept, we began working with a mouse model of mitochondrial disease that's called the end of S4 knockout or KO. This mimics human Leigh syndrome, the most common pediatric mitochondrial disease. So, first, we decided to measure the amount of oxygen in the brains of these animals, which is where the disease primarily presents. And so, here on the horizontal axis, you can see wild type, which means healthy animals, and then KO or knockout, which means mitochondrial disease animals. On the vertical axis is the amount of oxygen in the brains of these mice. And so you can see that these diseased or knockout mice have double the amount of oxygen in the brain compared to their healthy wild type counterparts. And so, if this is really the problem, and it's because the animals are not consuming oxygen because they have a broken mitochondria, then simply placing them in low oxygen environments, similar to living at high altitude, could theoretically bring down that excess oxygen. And actually, that's what happens. So, here I'm showing you what happens if you take these healthy or diseased mice and have them breathe half the amount of oxygen, which is the equivalent of about 5,000 meters altitude. And you can see that just doing this alone causes the oxygen levels in the brain of the diseased mice to come back down to normal levels. And so, if this is the main problem, this too much oxygen, then simply placing these animals in high altitude like conditions should theoretically have a beneficial effect. And so, some time ago, we tested this concept in this mitochondrial disease mouse model. So, here on the horizontal axis is the age of mice, and on the vertical axis is the percentage of animals that are surviving. And so you can see in black, this is the survival curve for these diseased mice breathing sea level air. And you can see that they really live to about 70 days of age and then they are all dead. And actually, if all that we do is put these animals in high altitude like conditions, they live much, much longer. So even at 250 days, half are alive. It's about a five-fold extension in lifespan. Very dramatic effect. And if we do the opposite of high oxygen breathing, it has the opposite effect and leads to death within several days or even hours. And so this is exciting because it led us to realize that perhaps a mismatch in oxygen supply and demand was the main problem in this disease setting, and simply targeting that might be protective. So we showed that we could prevent mitochondrial disease, but of course, this disease typically presents when patients are fairly far along in terms of their disease presentation. And so we asked, can we additionally reverse the disease and not just prevent it? So here on the vertical axis is body weight, on the horizontal axis is age. And in red, you can see that these disease mice lose weight over time when they're breathing normoxia, which means normal oxygen or sea level oxygen. However, if we have them breathe hypoxia or low oxygen, like high altitude, they gain body weight and they do well in black. Now, if we have another group of animals where we leave them in room air, normoxia, they are losing weight, they're about to die, maybe hours or days away from dying. We put them in altitude-like conditions, and the body weight trajectory reverses even within a few days. Most excitingly, we can do MRI scans of these mice at a very late stage of disease. These are two mice that are gotten MRIs of their brains. And you can see where the yellow arrows are pointing to these white dots. Those are the lesions that cause death in Leigh syndrome mice and in human patients. And even at this very late stage, when the lesions are already present, when we put these animals in hypoxia, we can in fact reverse the lesions and make them disappear. And so again, this was promising because we could actually intervene at a very late stage of disease, which is particularly relevant for the human patients. Okay, so this is great, but how do we actually turn this into a therapeutic strategy? And so I'll tell you now about our more recent work in what we'd call hypoxystat. And again, this is really a first step towards translation. Still much work to be done, but promising already. So first we asked, do animals need to be breathing low oxygen to be rescued, or can we titrate any other variable that affects oxygen levels in the brain? This is a complicated equation, but all we can focus on is that in red, there are many different ways to dial down oxygen levels in the brain. And so we asked if we tug on any of these variables, does it actually rescue disease and increase lifespan in the same mitochondrial disease mouse model? And so we would never advise doing this, but theoretically, low dose carbon monoxide actually competes with oxygen to bind hemoglobin, thereby causing less oxygen to be available to tissues, and so that extends lifespan. We can also just cause anemia, basically decrease red blood cell count. It has to be done in a very extreme manner, so again, maybe not practical therapeutically, but it also has this effect. Okay, so then we thought, as we've shown, that there are many ways to decrease oxygen levels, but what's the most practical way to do this in a manner that's, as safe as possible? So more recently, Skylar Bloom in my lab has started testing this concept, which is called a left shifter. And the name doesn't matter, but the way this works is that the red blood cells in our blood bind oxygen in the lungs. They grab onto the oxygen. As the red blood cells get to tissues, they release the oxygen into the tissues like the brain. And normally, this is usually consumed by the mitochondria, enabling reasonable levels of oxygen in the brain. However, in the mitochondrial disease setting, this oxygen is not being consumed. And so what if, to counter this, we develop a drug which we call hypoxystat that causes hemoglobin in red blood cells to hold on more tightly to oxygen? If that's happening, less oxygen will be released into the tissues and thereby serving as a drug-like form of hypoxia. And so to test this, we had several candidates in mind. And so these are the structures of the drugs that we'd been testing. On the left is this compound GBT440 that was already being developed by pharmaceutical companies that had this property, but it was being developed for a completely different disease, different reason. It had this property, but it was not very effective, and as I'll show you in a second. So we began looking through the literature for other compounds that might have a even stronger ability to hold on to oxygen and hemoglobin. And so we came across what we ended up calling hypoxystat. And so first, just to show you that the original compound, GBT440, did not actually extend lifespan at all, and so it just wasn't good enough of a drug. And so then we went really deep into medicinal chemistry, and I'm just showing you a table, and the details don't matter. But you can see that in this first column are many different variables that matter for optimizing a drug. So, for example, half-life or how long a drug stays in the blood, or hemoglobin occupancy, how much of hemoglobin is bound to your drug. So you can see for GBT440, it was only around in the blood for less than a day, and only 6% of hemoglobin was binding the drug at a given dose. We did a comparison with various other similar compounds and again settled on hypoxistat that first of all stuck around in the blood much, much longer, 121 hours, for half the compound to still be there, and over 30% of hemoglobin was bound to the drug. And we went really deep into trying to model how this is binding hemoglobin, and the details again aren't necessary, but just to understand exactly mechanistically how this drug was working to eventually try to optimize this even further. So first we asked, does this drug actually cause hypoxia or low oxygen in tissues? And so to assess this, we can use so-called biomarkers, which are proxies for how hypoxic an animal or a tissue is. So one well-known effect of high altitude or hypoxia is that you get more red blood cells. And so if we give hypoxistat orally every day to mice, we can expect that the red blood cell count will increase if it is in fact causing hypoxia, as we hope. And lo and behold, as we give increasing amounts of this hypoxistat for several weeks, we can see that the red blood cell amount massively increases, suggesting that it is in fact causing hypoxia in the tissues. We can then measure the expression or the levels of different genes that are known to go up in low oxygen conditions. And again, the names don't matter, but what you can focus on is that in purple or red, is the levels of these genes expression when you have healthy animals living in hypoxic conditions or high altitude conditions, compared to gray, which is sea level air. Now, if we give our hypoxistat, you can see that we increase these genes to a very similar level as inhaled hypoxia in purple, suggesting that we are actually doing a pretty good job of causing hypoxia in the tissues to a level that might be comparable actually to inhaled hypoxia that we've shown has this remarkable therapeutic effect. Not only could we reverse disease with hypoxistat, we could, not only could we increase the biomarkers, we could also extend lifespan. So when we start hypoxistat dosing at an early stage of disease, you can see it's about a 3 to 4-fold lifespan extension when given daily. So again, getting reasonably close to inhaled hypoxia effects. We can also look at the lesions in the brain, and these are, again, sections of the brain in these diseased mice, and these two are diseased mice that have not been treated with hypoxistat. And in green is basically a marker of the disease in the brain. And when we give this hypoxistat drug, that does not actually appear, and so we can prevent the neurological lesions from occurring. We can also reverse disease. And so here on the vertical axis is body weight. And you can see that when animals are left without treatment, they lose weight. And then right when they're at the brink of death, we can start our hypoxistat dosing and the body weight trajectory reverses and the body weight actually continues to increase. And even when we start hypoxistat at a very late stage of disease, so actually in black here is the survival curve for diseased mice that are not treated. And even when some deaths have already started to happen, if we start hypoxistat at this very late stage, we still see a lifespan extension to at least some extent. And so again, this is promising because perhaps we can help patients down the road even after disease has presented. So we're very excited about this concept. It's still early stages. There's a lot of work to be done to ensure particularly safety. It's known, of course, that extreme hypoxia can be toxic and lead to death. And so it's very important to proceed cautiously and develop next generation compounds that are even safer. And moreover, these types of drugs can also have unwanted side effects. And so there's much work to be done to develop the safety of these types of compounds. Hypoxistat was really meant to be a proof of concept, and so now we need to think about next generation compounds that have even better drug-like properties while still being safe and effective. And then importantly, we've only really tested this so far in one Leigh syndrome mitochondrial disease mouse model, but is this relevant for other types of Leigh syndrome, other genetic causes, and other mitochondrial diseases and beyond? And so we're excited. We think that this approach holds a lot of promise, but of course, there's a lot more work to be done. We really hope that someday this can make it in the hands of people that really need it, and hope to help patients suffering from these diseases in the coming years. Thank you.
Great. Thank you very much, Dr. Jain. It's a very out-of-the-box idea of decreasing oxygen, and surprisingly effective in this mouse model.